Hello everyone, my name is Ameeta Nayak. I'm a third-year medical student at the University of Ottawa, and over the next 5 minutes I will be discussing our research on the risk factors for urologic injury in women undergoing hysterectomy for benign indications. Urinary tract injuries are known complications of abdominopelvic surgeries. Hysterectomies in particular account for the majority of iatrogenic urologic injury, with reported rates ranging usually from 0.3 to 2%, but even up to 5% of hysterectomies. Hysterectomies are likely associated with urologic injuries due to the close proximity of the urinary and reproductive tracts. While urologic injuries do not occur frequently, they can result in serious complications. These include infection and sepsis if urine leaks into the abdomen, fistula formation, kidney injury, pain, and ultimately a lower quality of life. For these reasons, it is important to identify the women at risk for urinary tract injuries in order to improve our quality of care for these patients. That brings us to the purpose of the study, which was to characterize the risk factors associated with urologic injury during hysterectomy for benign indication. To do this, we performed a retrospective cohort study using NSQIP, a nationally validated database with data from nearly 700 hospitals. We identified women who were undergoing hysterectomy for benign indications and identified whether or not they had urologic injury using surgical procedure codes for bladder and ureteric repair. Univariate and multivariate regression models were created to explore the possible relationship between urologic injury and patient and surgical characteristics. During the study period, which took place between 2011 to 2017, over 200,000 hysterectomies were performed, and the overall rate of injury was low at 0.6%. When looking at the location of the injury, the vast majority occurred at the level of the bladder. On univariate analysis, we found a number of characteristics were associated with higher rates of urologic injury. Patients with urologic injury were, on average, younger and had lower BMIs than women without injury. Abdominal approaches compared to laparoscopic or vaginal approach, as well as total hysterectomies compared to subtotal, had higher rates of injury. Different rates of injury were also observed for different uterine diseases. Specifically, women with endometriosis and uterine fibroids had higher rates of injury. After controlling for those variables as well as functional status, race, and year of operation, we found that women with higher BMIs, specifically BMI greater than 40, had decreased odds of injury compared to patients in other weight categories, suggesting that higher BMI may be a protective factor. Potentially, increased adipose tissue separating the structures in the abdominopelvic region contributes to reducing the risk of surgeons injuring adjacent organs while operating on the uterus. For surgical factors, women undergoing total hysterectomies had increased odds of injury compared to women undergoing subtotal hysterectomies. This suggests more extensive surgical procedures increase the likelihood of accidental injury to nearby structures. What is unique to this analysis is that we found interactions between surgical approach and indication for hysterectomy, meaning that the effect of surgical approach on urologic injury depended on the disease for which women were undergoing hysterectomy. So for all women, regardless of their uterine disease, a laparoscopic approach was associated with decreased odds of injury compared to an abdominal approach, as shown here by adjusted odds ratios less than 1. When compared to vaginal approaches, laparoscopic hysterectomy still had reduced odds of injury with endometriosis, menstrual disorders, and pain. However, there was no statistically significant difference between the approaches for women with genital prolapse or fibroids. We believe improvements in laparoscopic skills, technology, and patient selection may be contributing to the outcomes that we see here. To summarize, urologic injuries are complications that have severe consequences. However, the risk of urologic injury in hysterectomy is low, at less than 1%. There are a number of factors that may contribute to the risk of injury, including patient characteristics of BMI, surgical variables of approach and total hysterectomy, and type of pelvic disease. These findings can help surgeons and patients in determining the optimal surgical management for women with benign gynecologic disease. Thank you for joining me today on this virtual platform. I look forward to hearing your thoughts and questions.